ANC palpation. First we will see what is the ANC palpation. So during the pregnancy we have to assess the fetus growth as well as the condition of the mother. So that is called the ANC palpation. So for that procedure, what we need the articles to conduct the procedure. So the clean tray containing one stethoscope to check the heart rate of the fetus, and then we need the torch to examine the eyes, nose and ear, and then we need one bowl containing with the cotton balls to clean the eyes if any infection is there, and then we need the measuring tape to assess the fundal height, and then after that we need gloves when skin irritation or any skin disease if it is there with the mother, and we need kidney tape to collect the waste. So we'll see here the head to foot examination, ANC palpation. First we will examine the head. In that, before that we will tell you what are the purposes to conduct the ANC palpation. First we can find out the any abnormalities during the pregnancy. Second, we prefer that we will assess the fetal growth as well as the condition of the mother. So these purpose we are conducting the ANC palpation. So first we will see the head examination. In that we have to check the appearance of the hair, the texture of the hair, and then we will see the any dandruff is there or no, any skin irritations or any scar disease if it is there, or any previous scar is there, we have to assess. And after that we will come to the eyes examination. In that we have to check the pupil. Normally the stable patient the pupil will be normal, and then we have to check the sclera, color of the sclera, whitish or any yellowish color we have to check it, and then we have to see the conjunctivitis, any inflammation if it is there in the eyes. If it is there, we have to take the cotton and we have to clean the inner canthus to the outer canthus. And then after that, we have to see the nose examination, that is any septum defect is there, okay, and then we have to see the any previous history of any discharge from the nose or any epithex if it is there, we have to assess. And after that, ear examination again, the any clear sound if it is hearing or no, and then otherwise any accumulation of the wax if it is there, blockage if it is there, we have to assess it. And after that come to the oral cavity examination. In that we have to see the assess of the teeth decay if it is there, or any cavities of the teeth. We have to assess the color of the tongue to check the anemia, and any coating if it is there, any infections, tongue coating, whole smell, or any gingivitis if it is there, we have to assess. If it is gum bleeding is there during the pregnancy, that is we have to consider it as normal because of it occurs imbalance with the hormones if it is there. Then after that we have to assess the neck rigidity. We have to check the neck rigidity if it is there or not. After extremities mobility we have to check, and then range of the motion we have to check the both extremities. And then after that we have to see the breast examination is very important to minimize the complications of the breast later on of the postnatal. Okay, because what happened if we are neglecting during the pregnancy because of retracted nipples or flatter nipple or introverted nipples, the baby can't able to suck properly, and baby can't take a proper feed after the postnatal. So to minimize all the complications we need to check the breast examination. Even though what are the skin changes occurs during pregnancy, that also we can assess. And we have to see the both chest, and we have to see the secretion of the milk, it is present or no, and the shape of the nipple, whether it is a flattened nipple, cracked nipple it is there, we have to check. And skin color changes, the primary areola, the secondary areola, and morbid tubercle is present or no, we have to check the skin changes of the both breasts. And if it is an introverted or flattened nipple, educate the mother to massage it every day herself, and we have to teach her how to pull it out to make the proper shape of the nipples. And after that we will come to the abdomen. So first 4 palpations we can see at the ANC palpation, that is the fundal palpations, lateral, right lateral palpation, left lateral palpations, pelvic and colic. These 4 palpations are the main thing to do during the ANC time. So first we have to warm our hand, because whenever we touch a normal hand, baby will sensitize and it may irritate to the mother. So we have to warm our hand. here, to here, like that you can see the, like that. With the ulnar grip you can palpate the fundus, and it is approximately the 38 centimeter. So this is the full term. You can see the growth of the fundus, and with this assessing the height, because how much growth is there at the term and how much growth will be happen the semester wise. So we can assess whether the preterm baby or the under low birth weight baby. So we can detect after the measurement. So after that, under the assessment, we will do the observation. In that, the umbilicus will be retracted and the tank is full, and then linea nigra and linea alba it will be seen. Linea nigra you can see the, and then after that the any scar, previous scar is there or no, we have to assess, and then shape of the abdomen. This is the oval shape at the term. If it is a longitudinal line, the normal line